And welcome to News Across Nigeria. I'm Anne Nwawadu. Coming up on the program today, more Nigerian migrants return to the country from Libya. We talk to an expert on the way out of the current energy crisis. And the Calabar Carnival set to begin with a display by bikers. Once again, welcome to the program. More Nigerians trapped in Libya have been returning home. The latest is a set of 157 persons, comprising of 54 women, 90 men, 3 children and 10 infants. Among the returnees are 8 pregnant women and 1 person in critical health condition. The returnees were received by NEMA officials at the cargo wing of the Murtala Mohammed International Airport. The Southwest Zonal Coordinator of the National Emergency Management Agency, Mr. Sulaiman Yakubu, who received the returnees, assured them that the federal government will provide them with special incentives to restart their lives. Mr. Yakubu also encourages Nigerians to use their experience to bring out the positive change to their lives. 2 years after Nigeria launched the World Bank-assisted Save 1 Million Lives program in 2015, the National Program Manager says that he is disappointed at the way some states have responded to it. The scheme is aimed at reducing maternal and child mortality through improved primary health care system.
The 2016 Maternal and Child Health Report by the World Health Organization reveals that Nigeria has the 3rd highest infant mortality rate in the world after India and Pakistan. According to that report, of the estimated 15,000 children who died globally before their 5th birthday, India contributed 24%, Pakistan 10%, while Nigeria contributed 9%. In 2015, the federal government launched a World Bank-assisted program called Save 1 Million Lives, which was targeted at strengthening primary health care services to reduce maternal and child mortality cases in Nigeria. The 2016-2017 survey report on the state of primary health care facilities, released by the Ministry of Health in May this year, identifies the poor state of primary health care system across the country, as some PHCs do not have basic equipment for treatment.
The state of primary health care in Nigeria did not start in 2015 in terms of the deplorable state of some of the primary health care centers. It's something that's been there for several decades. The rot has been there. But with this administration, government made it very clear that it was not acceptable. And because we've raised the conversation, people are paying attention. And we are doing everything possible to ensure that gradually, in the course of the next 2 years, we're able to try and improve the status of primary health care in Nigeria.
$500 million was secured by the federal government from the World Bank to strengthen primary health care system in Nigeria. Over 80% of this money has been disbursed to the 36 states of the Federation through the Saving 1 Million Lives program. Yet some of the states are yet to make appreciable progress.
I'm equally disappointed in another area, in the sense that some states have not really keyed in to the extent of allocating and taking, making judicious utilization of their funds as it is expected. In the sense that some states actually have resources, but are not really targeting areas that they should target. I'll give an example. For any state to have significant improvement in maternal and newborn and child health in Nigeria, that state must actually focus on primary health care. You know, if states continue to allocate 70 to 80% of our resources to tertiary, secondary and tertiary healthcare systems, certainly I can tell you that they will not achieve any significant improvement in healthcare.
10% of 15,000 global child deaths in 2016 is no doubt a huge national burden for Nigeria. Medical experts argue strongly that there is an urgent need for states to take full ownership of primary health care system and change the narratives once and for all.
Security forces have been deployed to communities in Benue State following threats allegedly issued by herdsmen to residents of Akwa in Otukpo Local Government Council area. Well, Governor Samuel Ortom has also asked members of the public to be extra vigilant and help security agencies by supplying them with information. He says his administration will not be distracted from fully implementing the anti-grazing bill.
Government have put in place adequate machinery and strategy to contain this. Just give us the information. These ones we have had already. We have taken measures that will surmount the challenge and the killings will not take place. But one important thing is that Benue State is united to ensure the implementation of the prohibition of open grazing in Benue State. And that will bring lasting solution. These are little challenges accompanying the implementation, but very soon we shall overcome them. And so I encourage our people not to take laws into their hands, not to go after reprisal, but allow government to handle this matter. I think we are better off in that way.
At least 4 inmates have been confirmed dead, while 36 others escaped in a jailbreak at Akwa Ibom prison in Akwa Ibom State. The spokesperson of the prison, Ogbaje, says that the prisoners had attacked prison kitchen staff before making their escape through the rear entrance of the prison. According to Mr. Ogbaje, the fleeing inmates seized an axe from an inmate attached to the kitchen, attacked him with a deep cut in his head in the process, and immediately made for the rear entrance of the prison. They broke a door with the axe and then engaged the staff that chased them in a battle. At the end of the scuffle, 4 of them that sustained gunshot lost their lives, while 7 others were recaptured. 36 are still at large, and search parties have already been activated to effect their recapture. Meanwhile, the controller of prisons, Akwa Ibom State Command, Alex Odita, has ordered an investigation into the circumstances surrounding the unfortunate incident. The Commissioner of Police, Muazu Halilu, has also appealed to members of the public to assist the authority with information that will aid the arrest of the fleeing prisoners, assuring that security has already been strengthened in all prison formations in the state to forestall a recurrence. The Department of Petroleum Resources, DPR, in Kogi State is making efforts to improve the supply of petrol within the state. During a monitoring and enforcement tour across filling stations within Lokoja metropolis, the regulator compelled attendants to dispense PMS at the normal price, while 5 of the filling stations were sealed off for non-compliance.
We've been buying for the past weeks. We've been buying 280, 300 and 310 respectively. But since you people are here, we believe things will be put in place and we'll buy at a very good pump price.
We have scarcity now, and we observe that some marketers will shut their stations in the daytime and sell in the night at exorbitant price. We are here to checkmate it and stop any marketer from extorting the public. Whether daytime or nighttime, fuel is 145 naira per liter. So that's why we are out doing night surveillance. And even to encourage NNPC to extend the hours they service the public. Usually they close 6 o'clock, but we have reached agreement with them to extend their time of operation to 10:30 so that they will service as many vehicles as possible. This is a temporary hardship. This is a temporary setback. As I'm speaking with you, vessels are discharging petroleum product. And in the question of in some few days to come, these queues will disappear and everybody will buy fuel without any stress.
In just a moment, when News Across Nigeria returns, we'll find out why these queues still linger on the roads across the country. Please stay with us.